From Capitol Hill, Democratic Senator Tim Kaine of Virginia. Great to have you on the show this morning.
Thanks, guys.
We want to
Good
talk
be with
about
you.
that second meeting with Vladimir Putin, but let's stay on health care.
You bet.
President talking about letting Obamacare fail, and then he'll somehow win. First of all, will Obamacare fail?
No, look, it's providing insurance for millions of people who've never had it before. Bankruptcies are cut in half. People with pre-existing conditions are protected. We do have to make improvements, Mika, and I'm a member of the Health Committee, Health, Education, Labor, Pension. I was on the committee for 2 days. I got on in January. 2 days later, I wrote a letter to the Republicans saying, let's take this matter up in committee. How do we fix it? How do we improve it? We're ready to work with you. Our committee has had so many meetings, but we won't meet about health care. We meet about nominees. We meet about the FDA. But what has happened here in the Senate has been an effort to jam something through. Now we need to do it the right way, listen to the American public and do it the right way. And I hope this effort will fail. The president rooting for health care to succeed means he's going to feel good if millions of people get hurt. That's just outrageous. We won't let him sabotage our health care system. We've got to work in a bipartisan way to make it better.
Senator, you're on the Health Committee. So how many meetings have you had with Republican senators who have tried to share with you the travails of their getting this legislation to the point where it could have a vote? Have you had any meetings with them?
Well, Mike, I've certainly discussed with many of my Senate colleagues on the committee this very thing. But again, the point I'm making is we've got a great committee. Our committee chair, Lamar Alexander, was a governor. He understands Medicaid. We've got a doctor on the committee, Bill Cassidy from Louisiana, Maggie Hassan, a governor who's got a disabled child. But we're not using that process at all. And I'll tell you something, the reason this thing has failed in the Senate is first because of people. You cannot threaten people's health care and expect them to go quietly. A mother of a disabled child told me about a week ago, I was having a roundtable meeting in Virginia, and she said they picked the wrong group of people to fight with. And I said, well, what do you mean by that? And she said, if you've got a disabled child, you fight from the moment that child is born for their health against doctors, hospitals, insurance companies, against social stigma, against school systems. You think we're going to let them slash Medicaid without a fight? They badly miscalculated when they went after the Medicaid program, which is for kids, folks with disabilities, and seniors. And now they have to set it aside and come back and try to do it the right way.
How about hanging a banner in the Senate with the words of Senator Shelley Moore Capito from West Virginia, who said the other day, I did not come to Washington to hurt people.
I did not come here to hurt people. And this is a lesson for the president, too. I think in this one, the president is learning that facts strike back. I think they've gotten sloppy down there, and they think they can say whatever and people will buy it, hook, line, and sinker. But this is a president who said everybody's going to be covered, nobody's going to pay more. I'm going to protect you if you have a pre-existing condition. I won't cut Medicaid. And when a House bill passed that shattered all those promises, he has a celebration at the White House. Isn't it great? This isn't a game show here. This is reality. And when you make promises to people about their health care and then you shatter them, they're going to remember, and the facts are going to strike back, and in this case they have.
Senator, it's Steve Kornacki. You've seen the political reality. You just talked about the bill that got out of the House, what Republican leaders in the House thought they were capable of getting their members to vote for, certainly here in the Senate. You see the political realities on the Republican side there. I know you just said you want to work in a bipartisan fashion. Let me just ask you, looking at the political realities as they are in Washington, realistically, is there anything you can say here specifically right now where you think there could be agreement between Democrats and Republicans on this?
Steve, I do. If we do it like we're supposed to, which is get in committees and hear from the public and then trade ideas, we can find improvements. I'll give you an example. I have a bill in to bring premiums down through using reinsurance. Now, you know, reinsurance, it's a backstop. Insurance companies have some, most people's claims are not that high, but then you have a very small portion of people who have very high claims. If you provide a backstop of reinsurance, then you can price premiums for the regular everyday person rather than the high cost. That brings premiums down for everybody. We use reinsurance in crop insurance, flood insurance, Medicare Part D. Reinsurance was part of the Affordable Care Act for the first 3 years, then it expired. It's got bipartisan cred. I have a bill just to reinstate the reinsurance provision in the Affordable Care Act, and it will bring premiums down. And other colleagues have similar bills, but thus far, we haven't been able to bring our bills up. We're like in a starting gate that won't open. My hope is that now people like my chairman, Lamar Alexander, and our ranking Democrat, Patty Murray, they've got a great track record of finding common cause on things like rewriting No Child Left Behind. Tough issues. If we can just do this the right way, we will find improvements that can get bipartisan support.